Early testing is a good thing, even if you have no symptoms. You just want a peace of mind to get it checked out. You know your heart's good. Another thing is that you get people with on-the-job stress is another thing that really beats on the heart constantly. People in high stressful jobs, political jobs, I would say. That all has to do with the heart too. So if you are also in a very high stressful job, that's a definite reason to come down and get checked out.
You're absolutely correct. Stress causes your adrenal glands to secrete the hormone epinephrine and norepinephrine, and as a result of the what we call fight and the stress, these hormones can increase the blood pressure and increase the heart rate. As a result, it puts extra pressure on the heart. And if you're under pressure throughout the day from your boss, from your employee, or even at home from your children or your husband or wife, the stress itself is a risk factor for developing heart problem and heart disease. Unfortunately, very few of us can really get rid of that stress. You can't really quit your job or divorce your spouse. But nevertheless, there are things you can do to monitor your blood pressure. There are things you can do to control the potential side effects of a stressful environment.
And not just that, but being, a lot of times being in a doctor's office is stressful for people. And, if you have a high stress job and you've been doing it for a very long time and you're getting up there in your 40s or 50s, you might want to get it checked out just to make sure everything's okay. And not just that, but there's also great stress relievers, which one of your doctors, Dr. Happel, I believe, who does an OMT, which we'll see later on in this program, which helps people through their muscles and their spine and ligaments and everything like that, and basically putting the body back to where it should be. Because a lot of times people come in and hunch over the computer and it's really crazy the amount of symptoms that you can get from each and every job, whether it's from being a computer worker or a laborer to a cement contractor to whatever.
Anybody's, and we all live based on the fact that our heart is pumping. If that small organ stop pumping, that the life ends. And all of us, we work very hard throughout our life to make a good living, to have a good family, and you want to take care of that small organ. You want to make sure that heart is keep beating and making sure it's well in tune and well in checked. Now, human body, it's a very complex and very interesting system, and you have to look at it as a full system. You can't look at it part at a time. So I hate when a patient tell me, I have to go for my heart to a cardiologist, I have to go for my glands to the endocrinologist, and for GI tract to the gastroenterologist. Next thing you know, one person is going to like 10 different doctors. These doctors, they just check his specific organs. They don't even communicate with each other. So each one is making sure one organ is good, but how about the whole body? How about the mind? How about the spirit? How about the whole system that has to work together? It's a very complex scenario, especially now that we're living in a very interesting environment. It's important to look at the human body as a full human body, not a small parts at a time.
And one of the things with heart and health in your practice is you and the other doctors that you work with, which we'll see later on in the program, they have this thing where they treat the whole. The first thing they do is when they take you in, they get a full history. They want the history of every medication, anything that's happened to you since you were 5 years old, all these things, because these contributing factors, a lot of people don't realize is that the accident you might have had when you were 16 or 17 years old, now you're 55, it's coming back to bite you, and a lot of people just don't grab that concept yet in health.
No. A few weeks ago, we were able to diagnose, we actually been diagnosing a lot of Lyme disease in this area. And getting a full history, getting a history of tick bite helps us to order a very simple test, a blood test, to look at to see if the patient was exposed to the Lyme disease. As you know, Lyme disease can stay in your body for years and has like 3 different stages to it. My website, I actually been spending a lot of time making sure my website, heartandhealth.com, is well equipped with the educational materials and also very interactive. So I have a specific part of my website dedicated to Lyme disease, which I think in this area, Eastern Suffolk, we are definitely predisposed to it. Going back to getting a full history, I think is very, very important as part of any physical examination or any doctor visit, to just review the history of the patient. And based on the history of the patient, we will find out this patient had a tick bite as a child. We were able to find out that the patient has a Lyme disease, and we were able to treat it successfully with antibiotic. And it's a curable disease. However, if Lyme disease is not treatable with antibiotic in a timely manner, that goes to the second or a third stage, and Lyme disease could affect the heart and could affect nerve system and brain, and unfortunately that's deadly and it's too late. So again, we're going back to being very proactive and doing early detection and prevention with the best tests that is possible, using the technology, using the new recent discoveries, and treat your body as a whole.
Well, Dr. Kavesteen, we're out of time, but I did want to thank you for coming on the program.
Thank you very much for having me.
I do appreciate it. We'd love to have you back, maybe later on during the year, maybe close to the holiday season. And we'll be right back with Heart and Health in just a moment. Stay tuned. We're with Dr. Faramanpour, and we had some questions for him. Now, he runs the family practice end of the medical office. And one of the things I had to ask you was, there's so much stuff going on right now as far as sickness and tests and results and everything that's coming out. Big thing, this is the warmest winter that we've had on record here on the island. What type of cases have you been seeing in? Has it been more mild? Has it been more severe? Things like that?
Well, to be honest, this is one of the warmest winters we've had in a while. And usually with change of weather and change of season, you do get a lot more colds and infections. As far as the influenza infection goes, there haven't been too many documented cases seen on the island as of yet, but there have been slight dips in the temperature, and so even from those little changes from day to day, people have been coming in with a lot more infections than you would expect. And some of these infections have even been serious enough to the point where we had some resistant strains where we had to send 1 or 2 patients to the hospital or treat the patients with a second round of antibiotics.
Now, that's another big thing that's coming out, is that we're hearing about all these resistance to antibiotics that are affecting people. Do you think it's becoming more prevalent as things are going on with some of these bacteria and germs and viruses?
There's always the threat that resistant strains can come about. Resistance, as I was telling one of my patients today, comes about when too many antibiotics are introduced into the community, and they're mainly spread either through overuse or through the hospital sector, where patients get exposed to a lot of resistant strains. And so you want to be careful, anytime. But I don't think it's become such a large threat that we can't get a handle on it. There's always newer antibiotics coming out, and this has helped to help alleviate some of the resistant strains and kill them. But there's always the threat that there's a super infection where no antibiotics will be able to kill it, and what do we do then? So as we were worried about H1N1, and it eventually came, and we got past it. So I'm sure by the time that comes, we'll have a solid answer, hopefully before 2012.
Another big bite that's been going on in the medical community, especially here on the island, is MRSA. That infection that originally came from hospitals, it's worked its way into the schools, which has got to be the worst place for any type of infection to be, with all the students and everything, communicable diseases, things like that. Do you see any change with that in the future with MRSA?
I have been seeing more MRSA, as have other physicians in the community. What MRSA stands for is methicillin-resistant Staphylococcus aureus. What most people aren't aware is that Staphylococcus aureus is commonly found on the skin, and it is a common bacteria. Now, where the problem occurs is when their skin is broken down, then you can have infection going on where the breakdown causes the bacteria to have an opportunity to affect underneath the skin and spread. That's one of the problems. And the other is, of course, hygiene and hand washing. The prevention of any infection always starts from hygiene and hand washing. And this has been proven time and time again. And if you're able to do that and keep your immune system happy, eat the right foods, exercise, and get plenty of rest, the old medication, fluids and rest, is always the best way to avoid any infection.
And there's also been talk about chicken soup and all the medicinal purposes now that they're finding out. Your mom always said, have your chicken soup, right?
Absolutely, absolutely. It just takes a while before science catches up to what we know to be true.
The other thing with diseases and everything else that's going on, we already discussed the MRSA. You have a lot of other infections that are out there this season that have, like, everything's coming back like new and improved now. It's not like something you could just, you took a pill and it went away for a couple of days. Have you seen a lot of that in the office?
It's always a surprise. Sometimes we see a lot of infections, not that we always know necessarily what we're treating. It's called empiric treatment, which means you base it on the patient's symptoms and the area of the body which is being infected, and you use the antibiotic that's most commonly known to treat it. Everybody loves to say, oh, can you give me a Z-Pack, as if a Z-Pack is going to cure the world. But honestly, sometimes you have to take a look at the patient, and the reason why we can't treat over the phone is because we have to see what their symptoms are, where the problems are at, and sometimes the stories can be resolved even without antibiotics, and it's not even an infection they have. They have other problems, and they are already playing doctor and assuming it's an infection. So with doctoring, we will never get placed by robots anytime soon because it's on a case-by-case basis.
And one of the things you had talked about with me prior to the show is how important the patient's history is, because now there's so much awareness now about drug interactions. You don't know somebody, Levaquin is a big one. A lot of people are allergic to that as an antibiotic. Some of the other antibiotics that are out there, they may be taking a certain other medication. That's why the pharmacies now have that whole thing that they do for drug interaction if something should be prescribed. So doing something over the phone and over the internet is fine to give you like a general idea of things that might come on. But you really need that office visit because they have to have your history and everything else going on like that, right?
Yes, there's actually two parts to that answer. The history has always been the essential key to any decision-making process. It's what we teach the medical students and community. Any good doctor knows that 85 to 90% of your decision making is based on the history, and the physical and the labs are there to support it. Where most patients assume that, it's the labs that are going to determine the deciding factor, when in fact that's only there to help assist the doctor in confirming a decision that he already suspects. The second part is you mentioned medications. Now, there is something important in the community that's more problem-based within the pharmacies and the doctors, and that is the dosage errors and the prescription errors that are going about. And what has happened recently that has helped to fix that is electronic medical records and what's called electronic prescribing or e-prescribing. And throughout the United States now, you have access to any pharmacy where you can electronically send the medication, the dosage, to the pharmacist, and they will get it. It's typed out, it's nice and neat, so there's no handwriting errors. Instantaneous and quick, so the patients don't have to carry the prescription, they can lose it. The pharmacist, 99% of the time, will get it on the other end. But like anything else, you have to watch out because there's always a chance of human error. You have to review the prescriptions, make sure it's sent to the right pharmacy, and the pharmacist always has to check to make sure there's no interactions. And that all comes into play. And some of the interactions are valid, and sometimes the interactions are there, but as physicians, we take a look at them and see how important they really are, because at the end of the day, it's what's best for the patient, and we need to sometimes override those interactions because we know the patients need the medication. And just because there's an interaction, like anything, any two medications, there's always a possibility of that. We have to be savvy enough to know what's better for the patient. We have to know the patient, know the drugs, and be familiar with all those interactions.
Yeah, because it can turn around and be something as from a mild headache to life-saving therapy for the heart or lungs or some other part of the body.
Right, and just to keep it simple, it's basically, I look at it as a one-step process. You want to make sure you take care of the patient when they come in because they're coming in for your services and for your advice and your education. And the first thing you want to do is make sure the patients get better. But I always, try to avoid them getting worse to the point where they're going to end up in a hospital and have a serious condition. So that's always running in the back of my mind, and I think most doctors. So you have to be smart enough to know how to head it off at the pass, while still providing, a lightning sense where the patient won't fear it and won't go home and say, "Oh my God, I'm going to die," because that's
Right.
always the back of their mind. Where for us, it's simple. We know what's going to happen, but they're not too aware, and they need that reassurance. And believe it or not, the placebo effect of doctoring and the reassurance factor, in my opinion, still plays a good fair amount, like 30% of the visit itself.
Now, one of the things I also noticed with your other doctor associates who we're going to have on later on in the program is preventive care seems to be a very strong thing that you guys push at Heart and Health over in Middle Island.
Oh, at Heart and Health, we definitely believe in preventative care. I myself and my colleague, Dr. Happel, were raised as family physicians, and Dr. Kavesteen, who's an internist and cardiologist. When we met, it was the forefront of what Heart and Health represents. Preventative care and making sure the patient gets good service, and they come in and they feel like they're getting their value for what they're there for, but also to make sure that they're taken care of. So what is preventative care? Preventative care can be looked at a few different ways. So one of the ways we break down preventative care is to make sure that we go over every aspect of the patient from head to toe and make sure that nothing is missed, to do the usual screening for their age group, and to try to foresee any problems that might arise and try to head it off at the pass. Now, sometimes that ends up helping the patient, but some patients, they ending up having more problems than they came in with. Some of the latest things that we're seeing that's a new trend in the past few years has been vitamin D deficiency.
Right.
Vitamin D, we know, is essential. It's gotten absorbed through sunlight. It helps with calcium absorption, cell function. But everybody that's been tested recently has had a deficiency in vitamin D. And we try to put them on vitamin D tablets